to manage their neuropathy. But we all know that those are not the ideal long-term solutions. All right, how about another question? What if we could offer you a better way to treat your neuropathy, and it could improve your condition by 60 to 100%? Would you be interested in that? Neuropathy is a disorder of the peripheral nerves. Those are the nerves that go down into your arms, hands, legs, and feet. The peripheral nerves are anything outside of the central nervous system, which is just the brain and spinal cord. So, the peripheral nerves, like the ones that go down to your hands and feet, are the ones that are affected in neuropathy. If you look on the right-hand side of the screen, you'll see 3 different types of nerves. On the top, there's a healthy nerve, and it has little blood vessels all wrapped around it. Underneath these blood vessels, you have what's called the myelin sheath. The myelin sheath is like insulation on an electrical cord, and your nerves need it to function properly. In order for that myelin sheath to survive, it has to be nourished by blood vessels like the ones you see in the picture. Looking at the middle nerve in the picture, it looks like it's starting to shrink. The constriction of blood vessels in this nerve decreases the amount of blood flow getting to the nerve, and it limits the amount of nutrients it receives. And eventually, if this keeps happening, it ends up looking like the bottom nerve, where it looks like it's dying off. This is exactly what happens in neuropathy. Peripheral neuropathy is one of the most common chronic conditions in the United States today. About 8% of the United States population suffers from peripheral neuropathy, which is about 24 million people and growing. Peripheral neuropathy can occur at any age, but it's most common among older adults. We've seen patients who have neuropathy who are from age 30 to 101. The most common cause of peripheral neuropathy is diabetes, and also idiopathic, which means the cause is unknown. But we can treat neuropathy that comes from many different causes. We don't only treat patients who have neuropathy from diabetes. Are you tired of taking medications? The truth is, most of us don't like taking a lot of medications every day, especially in the long term. They always come with side effects, and it's just not the ideal long-term solution to treat the underlying causes of your condition. The information we're going to share with you next might be a little scary for some, but we're trying to help you be informed about all the information you might need to know so you can make the best educated decisions. All the information we're about to present comes from the Centers for Disease Control and the World Health Organization, and you have a right to know about this as a patient. Bottom line, if we do the same things over and over again, we're going to keep getting the same results. We have a saying here in our clinic: if nothing changes, then nothing changes. This applies to both patients and doctors. The conventional approach to treating peripheral neuropathy goes like this: prescribe medication. Wait until the condition gets worse. Then maybe increase the dosage. Wait until it gets worse again. Then maybe add in some more medication. Wait until it gets worse. And then pretty soon you have to add in the really heavy-duty pain medications. This goes on until the patient is completely debilitated. And as a last resort, you have amputation. If you're taking medications like gabapentin, Neurontin, Cymbalta, amitriptyline, heavy-duty pain meds, and you've been doing this for months, years, or even decades, what could possibly change? We've seen the trends for more and heavier-duty medications skyrocketing, and we're here to break the cycle and take a different approach with our treatment program. Most patients are wondering at this point, okay, what's the alternative? How do I get healthy? Well, the good news is that the doctor who put together this program, it's his job, his mission, to fly around the country, attend conferences, read studies, and put together the best methods out there that have been proven for many years to help patients with neuropathy get better. These methods are helping thousands of neuropathy sufferers, and they're highly studied and proven, with methods outside of relying on medications, drugs, and surgeries. Your doctor has made a great choice to use this program, and you are in very good hands. This is our current medical standard of care. This picture comes from an article in a veterans magazine, and it describes our typical medical standard of care. It talks about that we have an epidemic in the US. We have a symptom care system, meaning that for every symptom, what do we have for it? Well, that's right, we have a medication. We have created a system that is fundamentally a reactive system, and it never looks at the underlying causes of our conditions. It just covers up the symptoms with medication. The article also talks about how we're in a health crisis in the US. For those of you that keep up with the news, you can probably agree that people are getting sicker and sicker in general, even though they have access to more and more resources around them to try to stay healthy. So, why is that? The article also talks about how we have an insurance crisis. Our country's health is going in one direction, but insurance coverage is going in another. We've been bombarded with chronic illnesses, and there is no medication, injection, or surgery that will correct a chronic condition. Our healthcare system was originally built off of an acute care model, which means that if you get the flu, break your arm, or have a near-death emergency, that's what our healthcare system is best at, and that's also what insurance is for. Now they're trying to force chronic conditions into this acute care model, but it's miserably failing. What kinds of health conditions are on the rise today? And what makes up the majority of all doctors' visits now? Well, we have things like heart disease, diabetes, and even neuropathy. And these are all chronic conditions. Chronic conditions account for 75% of all doctor visits, which means that only 25% are for acute problems. Unfortunately, as we just discussed, our healthcare system is geared towards solving acute problems and not chronic ones. However, chronic conditions make up the majority of all doctors' visits today. You can see why we have a big and growing healthcare crisis on our hands. How much do you think we as a country spend on healthcare in 1 year? Usually at these seminars, we'll get some guesses with very high numbers, like $100 billion. Well, that's close, but not quite. We actually spend $3 trillion a year on combating these chronic conditions, but they're still on the rise. At some point, we have to agree that it's not the money we throw at these conditions that's going to help. It's the actual approach that we're taking that's going to get people better. We live in the wealthiest country in the world, and to spend this kind of money on healthcare could be a great thing if it was making people better, but we have to look at the facts, and it's just not making people better.
Okay, so what's your plan of attack? Do nothing? Well, not a good one. Give us a call, 203-875-0846. This is Dr. Brian McKay from Neuropathy at Core Health. We're ready to help you, 203-875-0846. See you soon.